Today, I will try to share some of my thoughts on a prestigious golden hour project, which our team at Ramesh Hospitals has initiated about 15 years ago and want to take it in a big way as a global initiative from 21st of this month. As a practicing cardiologist for the past 30 years in Vijayawada, with the experience what we have as a team and also from the information available from the literature, we have come to an idea that taking up this project in a big way will definitely bring down the mortality, especially in very young people, in diseases like heart attack, brain attack and accidents. So, what exactly is this golden hour project? In diseases which are life threatening, which occur rather suddenly like heart attack, paralysis and accidents, a timely action taken within the first 1 hour, what we term as golden hour, can cut down the death toll by 50%. It is huge, without increasing the human resources and huge expenditure on infrastructure. Just by creating a chain of survival right from villages and mandals where 70% of Indian population live, linking to the tertiary and quaternary care centers with advanced technology like telemedicine, proper transport systems and strengthening the primary care centers, linking them with the tertiary care centers. It is very practical, feasible and possible to achieve this goal of implementing this golden hour project and cutting down the mortality. In India, we know the incidence of heart attack is almost 6 times more than Caucasians, Americans, Japanese, because of genetic reasons, and number 2, awareness and proper lack of infrastructure in the places where it is really required, like in the peripheries. So, what does this golden hour project mean? This golden hour project is taken up by a team, by our team. First of all, to create awareness amongst the public. Number 2, to create knowledge or to create at least one person in each house to have knowledge about these basic diseases and how to act at the real emergency rather than getting panicky. That means, one doctor in a house, doctor in the sense not in with a qualification, but with some basic knowledge. So, this we have already started with BLS program and try to expand it. Second is utilizing the telemedicine center, telemedicine concept, establishing connectivity to the periphery. Now, why is it important? So, exactly going into what is happening so far is, because of the heart attack in India, almost 4 persons are afflicted with this heart attack and 4,000 people are affected daily by stroke. That means, stroke strikes almost 4,000 people per day. Now, coming to the awareness, road safety, in India it is pathetic. If you see the statistics, for every 10,000 vehicles in US, 2 people die. In Pakistan, 32 people die. Can you imagine, in India it is not less than Pakistan, we are 4 times more. Almost 140 people die in India for every 10,000 vehicles. This is very poor state of affairs. What does it mean? The same thing, even A heart attack patient comes very late, brain attack patients go very late to the hospitals to seek medical treatment. So, what does it mean? Number 1, lack of awareness. Number 2, lack of facilities and proper infrastructure and accessibility and affordability, ignorance. So, how we can try to address each of these? As a group, medical practitioners in private sector and as a group in the public health services. So, everyone should come together, public private partnership, and then we should try to achieve certain basic goals. These are: number 1, in heart attack, what is the awareness that is lacking? Many people feel, or they do not think that it is heart attack. Many people feel that they will never have a heart attack just because their blood pressure is normal, sugar is normal, they do not smoke, they are lean, they are thin. No, so called low risk factors. No, if we see our intensive care patients, wherein 6 out of 10 heart attack patients do not have either high cholesterol or high blood pressure or diabetes. So, that means 6 out of 10 are so called low risk factors. The first and foremost important notion that since I do not have any of these things, I will never suffer from heart attack. This is wrong. Number 2, heart attack means the chest pain should be very severe. The chest pain occurs in the left side of the heart, chest. No, 90% of the times chest pain occurs in the center of the chest, above the navel, up to lower jaw, and often it is very mild, it is burning, and 95% of the patients think that it is gastric trouble and they go to a gastroenterologist. If at all they go to a doctor, they try to manage with some local remedial measures, Digene gel or some water or something, and they go very late even to the gastroenterologist. There also sometimes diagnosis has to be done very appropriately. So, this is another notion, wrong notion, that the heart attack, the location of the pain should be on the left side. No, it is not so. This is just because the heart is in the center of the chest during the embryological development and it turns towards the left, and for some reason the pain reflection in the brain, it is perceived when a heart is damaged that the pain is on the center of the chest, and this is the key, this is the most important factor why even educated people think that this is not a cardiac pain, this is gastric pain. This is the other one. The third most important is the affordability, and fourth most important is the suspicion or misbelief that they may be cheated. This is the other most important thing why patients come late. Now, coming to the misbelief or disbelief or mistrust is because people feel that unnecessarily cardiac surgeries are done, unnecessarily the stents are implanted. There is some theory, there is some reason for this, why they believe like that. Since the introduction of this bypass surgery or stent procedures, there has been an evolution in the science and theory, and there used to be a lot of difference between a senior cardiologist and a junior cardiologist as far as the decision making is concerned. One cardiologist used to say bypass surgery, one cardiologist used to say stents, some other cardiologist used to say only medical treatment is sufficient, because of the simple reason that there were no enough studies, there was not enough technology about 5 to 10 years ago from now, and we were just going by the intuition, by the experience, and how the patient's activity and the age and several factors we used to take into consideration. But now, let me assure the people that there cannot be difference of opinion regarding a particular type of treatment once a disease is established. So, when the blocks are there, now we know what exactly the line of treatment in a particular patient. whether it is 50% or 70% or 80%. Now, you have modalities like fractional flow reserve. You put a Doppler wire, measure the pressure across the lesion, and if there is a drop, that means the lesion has to be addressed. Your eye may falsely interpret it as 80%, he may not need. Your eye may falsely interpret the block is 50%, still the patient may need either a stent or a bypass surgery. So, now the science is very clear, the guidelines are very clear. So, we have to follow the guidelines before spelling out what exactly the patient needs. So, now the suspicion and this mistrust should go, number 1, and now once that is not there, the affordability. How do you improve the affordability? Unfortunately, in AP, Andhra Pradesh, the people who go for private insurance has come down from 900 crores per year in 2009 to 600 crores meager, whereas all over the globe and in all other states in India, even in Bihar, it went up from 10 to 30 times. So, because of whatever the schemes and whatever cheaper modes of treatment, this has happened. So, everyone, every family, it is their responsibility to be prepared to take care of health expenditure for them or for their family members. Now, you have several insurance schemes, mass insurance schemes, where they cut down by 50% the premium, where we do for our employees and all, wherein if properly applied, the insurance scheme is the best method to improve the affordability. Many people do not pay insurance. When we ask them, we paid for 10 years, we did not have disease, so we stopped paying. If they pay and if it is not utilized by them, it is utilized by their other people, they should feel that happiness that they did not have the disease, but this cannot be a reason to stop payment. So, this is the other most important thing of the affordability. So, now once the affordability aspect is taken care of, once the mistrust and disbelief aspects are taken care of, now how to approach the mandals and villages. The mandals and villages where 70% of the population in India live, what is the problem, current problem now? Deficit of trained doctors. If you see in the overall country, for the population, you do not even have 1/3 of the required doctors. So, why will they go to the villages and mandals? For education, children education, family life, most people prefer at least city or semi-urban life rather than going into the villages. Then you can, so it is not possible to force everyone to go there and work. So, now what is the alternative? All over the world, even in US, European countries, now this problem, there also the problem is there. There is shortage of doctors, shortage of nurses, shortage of paramedical people. How they are addressing? The best way is the World Health Organization has recommended you have to have upgrade the primary care centers in and villages and see that these are linked to the quaternary and tertiary care centers, so that there is no distinct gap between the treatment modality that is offered. First aid can be offered by these telemedicine centers, and so that in majority of the patients, almost 80% of the patients with the present day technology, you do not need to touch the patient. With the diagnosis, with the laboratory tests, with the symptoms, you can make most of the diagnosis. So, now there is no need for the patient to travel hours and hundreds of kilometers. So, this is the other method. Now, applying these principles of creating awareness, making them prepared for affordability of treatment and providing infrastructure accessibility through this telemedicine and bringing the public and private medical fraternity on a single platform, we can definitely improve the health care of the area. Now, in this golden hour, what do we do? In a heart attack patient, first of all, diagnosis is very, very important. Even in US, 4% of the times people who go to the emergency room, diagnosis is missed. So, ECG is normal in the first 1 hour. So, people are misdiagnosed, they are sent home, they land again within a few days or within a weeks, and they die suddenly because of heart attack. So, the knowledge, creation of the knowledge that ECG can be normal even in heart attack. So, make proper accurate diagnosis. Okay. Now, coming to these aspects, improving the diagnosis, what you can do once you make a diagnosis of heart attack, within the first 1 hour, if you open the heart attack which is clogged because of the clot or fat, by taking out thrombus or blood clot by aspiration catheters if necessary, or by improving it the flow by balloon angioplasty and stent implantation, you can make a dying heart muscle beat again strongly. Almost nowadays, the heart attack is treated just like a routine fever, appendicitis. People can get back to their work within the next few days, and they can forget about an ailment which was thought about 40-50 years ago. When I was a student, a heart attack was considered very, very dangerous. 50% almost used to either die, or just they were floored, or they were almost bedridden, and they were not allowed to climb up the stairs. They were not allowed to go to the office, and they more or less their life is condemned even if they are alive. Now the situation has changed. Heart attack is like any simple ailment. Similarly, your stroke patients, we know that 4,000 patients are afflicted with stroke every day in India. So this is a problem, this is a menace, and stroke is more dangerous in a sense compared to heart attack. Heart attack, once the patient recovers, majority live their normal life, but stroke causes more misery, more morbidity, and lot of discomfort to the other family members who have to attend. So you have to give equal importance to brain stroke. So brain stroke, what is the treatment? Almost about 7-8 years ago, treatment was not there for brain stroke compared to a heart attack. In heart attack, almost for more than 2 decades, 2.5 decades, we have this treatment, emergency angioplasty and all. For brain attack also, now the golden hour, same golden hour concept is being applied. That means, if you recognize the patient with the stroke, paralysis, it could be a simple deviation of the mouth, or the patient is not able to talk properly, or stammering, or there is mild weakness of one hand or one leg, or suddenly there is total paralysis. If you make a proper diagnosis, and if you exclude that there is no hemorrhage in the brain by making available simple CT scan machines, simple machines, if you make a diagnosis, if you give injections within the first 1 hour, so called golden hour, we have seen patients recovering and walking within 24 hours of a major stroke, and we have seen patients who are bedridden for 10 years and 15 years because of the stroke, paralysis. So golden hour applies very well to paralysis patients, so called stroke patients. Now the treatment is more advanced, not only giving injections, you directly go into the brain vessels with a catheter, try to take out the blood clot, or give injections directly into the blood clot, so that with a smaller dose you can achieve optimal result. So you have wonderful treatment for stroke in the, if you give it within the golden hour. Now, but unfortunately, many of our colleagues, many of the people do not know that such treatment exists even for paralysis. People used to, the very old treatment, just giving rest, nothing else, and some aspirin tablet or something. No, now treatment has changed, modality has changed. Act properly, you can definitely do some miraculous job for the patient and patient's family. Now, coming to the accidents, this is another important aspect. If you see the statistics, and India unfortunately either because of loss, very poor systems, poor safety measures, ignorance, many people die because of the rash driving or improper safety, road safety measures. Okay, once an accident occurs, how to save the life? Many deaths occur because the accident victims do not have the accessibility or do not receive the proper treatment within the golden hour. What happens in golden hour? Everyone knows it is not because a head is smashed or because a heart is totally damaged in an accident. It is only a simple trauma wherein there is some bleeding vessel, either it is in the leg or it is in the hand or it is in the abdomen or neck, anywhere. So, if if these people are accessed by a properly trained persons within 1 hour, you can definitely take measures to stop this bleeding, provide blood transfusion, provide IV fluids, see that they breathe properly, and during transport damage is not done. So, all these things you have to see that the accident victims receive, because accident victims are relatively young. There is no reason why they should die if proper chain of survival systems are established for accident victims. It is everyone's duty, both in the private and public sector, and the common man, how to see that fellow human being is helped in case of in times of need, in case of emergency. Now, so putting everything together, if you people like it can our hospital, our team has come up with proposals or concepts which should be some sort of global initiatives. Everyone in a house should have some basic knowledge of how to treat these emergencies, how to access proper care, how to be prepared to meet the expenditure. So, every house should have, in other words, at least one doctor or a doctor or a person who can have understanding of the emergencies, not getting panicky. Many times we see why patients die of heart attack, when especially in the night times, because in the night time it is often mild pain. It is not like what you see in movies, pain is always mild, 80%, only 10 to 20% will have severe pain. So, why they neglect is the pain intensity is less, that is why they waste this golden hour, they wait till the next morning, then they do not have proper access, transport, and they do not want to disturb their spouse or other children. This is the other important factor what we have noticed. This is very wrong thing to do, because if they become more critical, that causes more discomfort to the family members. That is why, and that is the other reason why they wait till next morning. Golden hour, and many people think that few hours or one day nothing will happen. No, golden hour, everything matters. In first 60 minutes, millions of heart cells die. In first 60 minutes, millions of brain cells die irreversibly. There is no way you can retrieve, you can bring life. And in the first 1 hour, several 100 ml of blood can ooze from damaged area. You should know methodology, where the artery is, how to press the artery, how to stop bleeding. It is a simple common sense. If many educated people, need not be doctors, they can learn how to do it. So, our concept is, from our hospital we formed a team, we are launching a website on 21st of this month, and we want the cooperation of the people, could be engineers, lawyers, anybody, business people, students, paramedical staff, everyone should participate, and we feel that they have to adopt their villages as part of this social responsibility. And nowadays you are fortunate even in village. Now by June you are going to have fiber grid, optical fiber grid in our state, which is going to become Arogya Andhra Pradesh, which will be a model state in the country. With this fiber grid, you can establish a telemedicine link to the tertiary and quaternary care centers. So, the general public responsibility is to create awareness in their village, and to see that the proper connectivity is established, and monitor periodically that the healthcare delivery system is proper and it is established and it is being delivered properly. So, with this golden hour project, the program which we are going to launch in a big scale, in fact the concept has been there, our team has been doing it for the past 15 years. We have been taking, we have donated computerized ECG machines in 14 centers in Krishna, Guntur, West Godavari, wherein facility was not available for ECG. We put these in villages and mandals, where almost several thousand ECGs were taken for chest pain patients, just for very minor 20 rupees. And similarly, lot of pamphlets about trying to give knowledge creating awareness about how a heart attack looks, how the misconceptions of heart attack are there, how people are dying, young people are dying because of the delay of 1 to 2 hours also, why we are unable to save some people. So, we want to take up this program in a bigger way and try to see that we also collaborate with the other public health programs also, and as through the CII, through Confederation of Indian Industry. So, likewise we want to involve several organizations, NCC, and then there are several voluntary organizations which have come up to help us in this program. So, our request is everyone should take up health as a priority. It is not wealth, health is wealth. So, wealth comes only after health, and everyone should feel that as long as you are happy and healthy, or if you are healthy only, you will be happy, and sometimes even crores of rupees cannot save or cannot give you comfort. So, on this occasion of launching this golden hour program, our request is to seek the support from all the people, from the public, private sectors, and to take this as a major initiative. We think this is going to give or bring lot of change in the healthcare delivery system in our country.